So morning, everyone. Thank you, everyone, for joining us today for what is the fifth and final group session of the Digital Inequality Pioneers programme. And today is a slightly different session. So where we've done learning programme sessions for the previous four, this morning is a panel session. And we're joined by three incredible women who we at Thrive by Design have had the pleasure of working with over the last couple of years, and who are really blazing a trail with the work that they're leading in inclusive digital transformation in the regions that they're working on, and have been for a number of years, not just over these last couple. So we're really excited to bring the three of them together and quiz them today. We want to kind of ask them some questions. We want to really hear what they've got to say in terms of their experiences of the work that they've been doing, the challenges that they faced in doing this work, because we all know through the programme and the conversations we've been having that this isn't easy, and it's not a quick thing to kind of turn around. So hopefully this morning will give everyone the opportunity to hear their side of things, their experience, their knowledge, their stories, and for you to be able to ask them questions and really try and get a little bit more out of this session as well. So I'm going to hand over to them in a minute just to do a quick introduction. So first up, we've got Alexis. Do you want to say hello, Alexis?
Hiya, yeah, sorry, that's a bit of an introduction, Tim, so we've got a lot to live up to now. I think you forgot angelic. Sorry, the sunshine's shining through my window. Oh, sorry, not sorry, really, because we've not seen much sunshine, so I'm not moving at all. I'm Alexis Farrow. I'm Head of Strategy and Transformation for Connected Nottinghamshire, which is in effect the digital programme across Nottingham and Nottinghamshire Integrated Care System. Did you want any more at this point, Tim?
No, that's all good. Yeah, you're going to do a bit of an intro in a second, aren't you? We've also got Linda.
Thanks, Tim. And yeah, I agree. That's a lot to live up to. Thank you. So my name's Linda Vernon. I'm currently the digital the digital culture and transformation clinical lead for Lancashire and South Cumbria Health and Care Partnership. So that's essentially a CCIO role. I'm a physio by background, and I suppose a physio at heart, really. I suppose I was the one to start leading some of the work in digital inclusion, and thankfully I've got a team now supporting me with that. But it's my baby. It's the thing that matters most to me, I think, in the work I do.
Thanks, Linda. And we've also got Sarah with us today as well.
Hey all, I'm Sarah Boyd. I'm Head of Digital Experience and Transformation at Norfolk and Waveney, ICS, ICB, whatever letters we're going to get when that gets formalised.
Thanks, Sarah. So we're going to start in a minute, and we're going to hear from each of the three, just giving us an introduction to and an overview of the work that they're doing in their different areas. And like I say, once we've done that, we'll get on and we'll get into the questions. So first up, I'm going to ask Sarah if you're all right to present your session. So if you've got some slides, I think, just to share with us.
I might start talking first and decide whether I'm going to use them. So in true style, I'm going to wing it. So a bit like Linda, when I started in this role, digital inclusion wasn't something that was in my job description or job title, but it's something that increasingly I became really interested in and passionate about, and had been following people like Habitat Now Thrive for a while, Good Things Foundation, knew that stuff needed to be done, but had never been in a role where I could kind of make stuff happen. And then within this role, I was like, nobody seems to be doing it. Does anyone mind if I have a go? And the answer was yes from my boss, but kind of flew under the radar. And I think part of my message today is that that's what's been really useful around the digital inclusion piece for me, is that we've been kind of doing it on the sidelines, doing it with people who are interested, finding where the energy is and kind of getting going. So where we are as an ICS is we are the least digitally mature ICS in the country. And that isn't because of capability or capacity or ambition. We just have a chronic underfunding problem, which we can kind of show across the years in terms of how people have prioritised and spent on digital. And obviously in the pandemic, it's meant that we are pushing more and more people onto digital platforms and exacerbating the inequalities that we see in Norfolk and Waveney. And so we have to do something about it. And so that's kind of how we're looking at it. So I will share my slide. So what I did is I had kind of no clue. It was a brand new area to me. what I had a look around to see whether anything else was happening. Sorry, let me just move to share mode. There we go. And this messy model, because my graphic design skills are nowhere near those of Tim, is that we knew we had this bunch of people that we were currently excluding by the way that we were working. We didn't quite know who they were or where they were in our system, so we knew we had to identify some need. And that's both, for me, we've been focusing on our citizens at the moment, but we also need to start this work with our staff and our staff groups as well, because we've got some really big digital programs coming up across the system. So we don't have an EPR in any of our 3 acutes. We don't have a shared care record. So there's kind of big programs of work coming up that are going to really mean that we need to be careful of how we're digitally excluding our staff as well. So we asked Thrive to come and help us, and they did some incredible work around looking at what our exclusion looked like across Norfolk and Waveney, and kind of what assets we already had in place, what things were already working for people. And we looked at how funding was coming in and how that could work. And one of the things that we've come up with is this, we've realised that our county council are doing incredible work in this space already, especially our libraries team. And we're lucky in that we've got one of the most used library groups as a region. So Norfolk and Waveney, we've got really heavy, good relationships with our local libraries in the communities. And so what we're looking to do is create a kind of central hub model where people can be referred, picked up, found anywhere to be digitally excluded and referred into a central point, which would be the county council. They would do assessments, too strong a word, but like a friendly chat with people to understand what their needs are and see how they can best be served, and wrap those needs up with wider support the council can provide around hardship or adult learning, etc., etc. But then we are really keen that we want to point out to community, voluntary sector, grassroots organisations that are already doing exceptional work in this space and where people may feel safer to go and have that support. So it's kind of a place where we can make it easy for people to get support, but then they get pushed or they get referred out or get a choice of where they go and how they feel that support. Even in the central hub, you may never know it's a library's. They might visit you in your home, or do it on the phone, or you may pop into a library, or as we said, if you've got already got a relationship with a safe space, that might be in your mosque or your local village hall where they do some support with how you use printing and stuff, and that's where you go for your advice. We want to be able to advocate for kind of both still existing, coexisting together. And so part of our model is both funding the central hub and setting up a non-competitive grant scheme that allows grassroots organisations to have funding and access to develop their digital inclusion services. Because some of the work that Thrive did for us showed that one of the biggest issues the voluntary sector had is when you put out this grant funding, they bid against each other and it kind of stops them from working collaboratively. So we wanted to create a way of supporting the grassroots organisations with funding without making it competitive. And some of that will be back into the identifying need and the data. So if we know there is a community of interest or a part of our region that specifically needs this support, then we'll be able to fund that the best grassroots location to support this kind of overall model. So that's my messy diagram, but hopefully it makes sense. And then I'll share these slides afterwards, but kind of the key points is what we're aiming for is we want it to be really person-centred. Obviously, we don't want it to be a health silo or where we were getting to where you had kind of a digital inclusion approach for cancer and one for dermatology and one for personalised outpatients and one for my planned care and all of these things that are popping up. We didn't want to have a solution. We wanted to be able to scoop this person up and say, here you go and have a conversation. What is your need? And if their first need is, actually, I just want to be able to FaceTime my family, let's work on that. And then let's build the confidence and then move on to the things that we kind of require from a health perspective. And again, Thrive have got some amazing stats to show that's a really positive way of increasing digital health behaviours. We were lucky in that we had really good relationships with our county council and our libraries team already, so we've been able to build on that. But we weren't an expert, and having Thrive involved has been massively invaluable. We're now moving into how we consistently fund this. So every time we bid for money or the centre offers money, so things around personalised outpatients, we're asking for money to go towards digital inclusion and using that to create a kind of central way of funding this service. And also we're looking at potentially asking each of our healthcare organisations to put a small per organisational annual charge to provide the consistency into it, and we're currently creating the business case for that. I mentioned the grassroots grants, and actually our biggest challenge is around identifying the need, establishing the relationships with the communities, and kind of marketing to them to let them know that it's out there and make them feel safe enough to go and access that support. So that's my super quick session on slides. I couldn't see my clock, so hopefully it was the 5 minutes.
Absolutely perfect, Sarah. Thank you. That's brilliant.
Let me stop my share.
And I've already just been scribbling down loads of things that I definitely want to ask about as well as we get into the Q&A. So thank you so much, Sarah. So Alexis, are you all right to go next? And then Linda might jump back in.
Yeah, no worries. So I'm not as prepared as the others in that I don't have any fancy slides to show you, but I just wanted to share our experiences and some of the learnings that we've kind of found along the way. So we started our journey, I suppose, about 5 years ago, where we knew that we had a strategic priority around public access to digital health and care services. But it was always put in the too hard box, so we didn't kind of address it at that point. We were too busy focusing on sharing across organisations, infrastructure issues. So like the others, I kind of fell into it. Like I was tasked with developing our approach to public-facing digital services. And I wanted to take a really different approach to this. So we knew that we had lots of pressure, national policy, contractual requirements that meant that we had to deliver some type of digital services to our population. However, I didn't want to be reactive in that we just go out and buy something and chuck it over the fence and expect people to behave in a different way. So for me, inclusive design is not just about the digital inclusion element, but it's about the user-based design element right at the start. So we took about 18 months to do some real in-depth insights, research, and population engagement. So we went all over the place. People laugh when I say this, but we didn't just engage with people via traditional means. We went and stood in the market squares. We went to local community events, but we went to things like beer festivals, which was really good fun. But actually, from a professional perspective, it did give us loads of information and enabled us to talk to lots of people that we perhaps wouldn't interact with before. So from this, we kind of developed our public-facing digital services strategy. And it was quite clear from the engagement that we'd done with our population that unless we start to think about how we are more inclusive about providing digital services to our population, then we're not going to see, quite selfishly, we're not going to see the return on investment that we would expect. We're not going to see that cultural behavioural change with our population. We had to do something around this space in digital inclusion to support our potentially more complex and needy patients in accessing some of the services that we're looking to shift into a more digital format rather than face-to-face. So I think similar to Sarah, we kind of didn't know where to start. It was before digital inclusion was the sexy thing that everybody was talking about. It was kind of something that was thought about by the experts. So, you had the Good Things Foundation, for example, and they were doing lots of really good work, but I don't think it was widely spread, the kind of message around digital inclusion. So reached out to the Good Things Foundation to say, where do we start with this? And I'll be completely honest, I think reflecting on it, we were really naive to begin with, because we thought, do you know what, we can save the world with this, and we can really tackle our digital inclusion. But actually, in isolation, as the NHS, we absolutely couldn't do that. I mean, not to say that we didn't make some really good progress. We put lots of schemes in place to help support people. We tried and tested things. So we did things like digital hubs on the high street running from our local libraries, but we weren't necessarily getting the uptake and the reach that we wanted to. So COVID happened. So we had to kind of change the way that we worked and how we were trying to still maintain that support from a digital perspective to our population. So we did things like tablet lending schemes. We opened a telephone help and support line, so people, if they were wanting to learn how to engage, particularly those isolated groups. So we had, lots of elderly members of our population with respiratory conditions, for example, that were unable to access the community support services that they used to in a face-to-face manner. So We work with specific targeted groups. And again, that wasn't even touching the sides really, as far as what we needed to do as far as getting that kind of that skills and access. So we did another piece of insights work, and what we kind of learned quite quickly was the only way that we're going to do this is to bring everyone together and to really utilise our community and voluntary sector. So again, we set up, I think similar to what Sarah's saying, a grant scheme. So we've offered grants to our local community voluntary sector so that they can support their communities, because what we found, particularly with hard to reach groups, is that they weren't coming forward and engaging us. So whilst we were positioning ourselves in libraries and going and sitting in job centres and providing that support, unless people were actively accessing those services, we weren't reaching them. And we found that the best way to do that was through local community groups. We've done some really cool stuff as far as trying to plot on a map everywhere where there is digital or support and training available to people. So whether that's private sector based, health based, local authority based, or community and voluntary sector, because in that way people can choose where to access services and be aware of what's already there. And it helps us from a strategic point of view identify where there's gaps. So if there's a geographical location that's got high levels of exclusion, and there are very limited services in there supporting people, we know that we can then target those areas and provide more funding and support. We've also done some really cool stuff around what came out of our insights was a concept of digital carers. So 1/3 of our population acted as a digital carer in some form or another. So whether that was supporting somebody in accessing digital services or doing it on their behalf. So we've pulled together on a kind of a website, lots of resources about how people can do certain bits of stuff on digital. So whether that's accessing NHS app, for example, whether that's making a Zoom call. And we've provided the ability to people to go in and then share that via other means. So what we also found out is whilst 1/3 of our population act as digital carers, 80% of our population use things like WhatsApp. So being able to share key information via that platform, they might be digitally excluded, but they might still use WhatsApp. So how can we better cater for those people and support those people acting as carers? It's also really useful for our social prescribing team. So we've kind of provided this resource to enable our social prescribers to then direct people to the most appropriate support and resource to them. And just the final note, because we've done so much, I'm trying, it's a bit of a vomit, but the final thing that we are starting to do now is to recruit digital inclusion officers within our community groups. So we've got funding for 10 digital inclusion coordinators across our PCN areas, and the role of those coordinators is to work with PCNs, but to also work with the community groups within those PCN areas. I'm going to stop for breath because I know that that's a lot of information, and I suppose just to offer out, I'm happy to speak to anybody outside of this meeting if they want more information about a certain scheme that we've run or how we've approached certain things. I'm happy to provide more detail into that.
Perfect. Thank you, Alexis. That's amazing. And like, as you say, the vastness of the work that you've done over the years and the way you've had to almost like continue to iterate your thinking, not just the solution, but actually go back and go, hang on a minute. Do we really understand this enough yet? Do we need to go out and get more insight, more understanding of people's context? Is really good to see that journey that you've kind of been on. So thank you so much for sharing that. Linda.
I'm back. Sorry, I've had to jump on an iPad. It's not connectivity as in Wi-Fi, but for some reason my laptop's playing up. So I missed most of Alexis, and I heard a bit of Sarah, but it was very broken. But I think you can probably hear me okay now. I was able to hear good since I rejoined. And I think Rob's going to share my slides for me, if that's okay. Thank you. Super. Okay, so if you ping on to the next one, please, Rob. Has it moved? Oh, there we go. So yeah, so gathering from what I could hear of others, you know, we've been on a bit of a journey as well over the last, I suppose it's four years or more since I started in this area of work. And at the time we were developing our digital strategy for the ICS, which is the image you see on the right. Some people might recognize that. It's what was known as the digital placemat back in NHS digital days. And the Empower the Person programme was really where it sat. Because we recognized that in order to meet the 5 whats of how do we empower the person that are on the left, we needed to ensure that our public and patients were able to access services and access digital. But I think one of the important things, and I'm not going to talk about it today, it's more the digital inclusion side, but one of the things you'll notice on the image on the right is the double-edged arrows between the Empower the Person theme of our strategy and everything else. And the reason for that was that we wanted to ensure that we also co-design services with patients. And that's a big challenge. We've not nailed it yet. We're probably early in our journey of user-centered design, but I think there's sort of 2 sides to the coin, really. There's the UCD piece that ensures that we are designing services that meet patients' needs, as well as then supporting patients to access those services. Which is more what I'm going to talk about today. So if you move on to the next one, please, Rob. Thank you. I'm not going to dwell on this, but we've talked a little bit, and I know we're going to talk later about partnerships. It's, you know, digital inclusion is everyone's business. We've always said this. It's not health alone to solve. There's lots of fantastic work going on in local government and in third sector organisations on the ground delivering digital support to patients and really meeting them where they're at, which is why I think they're such fantastic partners to have. We're also really lucky that we have a digital skills partnership in Lancashire. That's we were one of the flagship sites for a DCMS funded digital skills partnership that's hosted by Lancashire County Council. So that sort of was a bit of a springboard for us. But without, you know, adult learning, libraries, third sector organisations and some of our private partners, we wouldn't be able to do what we're trying to do at the moment. So if you move on to the next one. So this is, people may have seen this before because it's kind of done the rounds a little bit over the last couple of years, but we've really tried to ensure that when we address digital inclusion, we're addressing these 4 areas. So not just devices and connectivity, which I think, to be fair, is more where the local government have really worked on. They've supported in terms of resourcing devices for people, especially during the pandemic. You know, they've done a lot more work in this space than we have. But we've started to ensure now that all of our programs in digital inclusion have support, at least to give our third sector partners some devices to enable them to support patients and public, but also for those patients and public as well. And then we've sort of used the term digital activation, really. That's our key phrase, building on patient activation. So patient activation being knowledge, skills and confidence. We talk about sort of digital activation being the knowledge, skills and confidence to use technology, but then digital health literacy being the sort of 4th pillar, which is around what can we do? And this is things like, how do we enable better app prescribing for frontline staff? How do we enable them to support their patients? And how do we make it easier for the public to find our digital tools? And back to that UCD and co-design piece around ensuring that the device, that the tools that we procure are actually fit for the needs of the public we're trying to serve. And there's an underpinning sort of arrow that goes across all of that, which is around data. We've never really collected data in health about people's digital abilities or not. We collect things like emails, and we use that as a proxy for somebody is digitally activated, but it's probably not the most reliable proxy. And again, during the pandemic, we started to use more of our local government data that's able to help us to predict where there's likely to be higher levels of digital inactivity and digital inequalities. So I'm not going to dwell anymore on that one. If we can flick on to the next, and I'll just run through some of the things that we've been doing, particularly over the last 12 months. So really what we started mostly in primary care and community services. So it was really trying to get as close to people where they were at. And we've got some staff who are dedicated in primary care to supporting frontline staff to become digitally enabled, but they're also starting to engage more in the digital inclusion agenda in primary care as well. So that's a sort of a primary care initiative. The three in the middle are the sort of the BAME and deaf communities and the learning disability and autism communities. Those two projects they're coming to an end at the moment, where we've really targeted our most vulnerable. And actually the BAME and deaf project has expanded. It's gone much wider. We've got probably around 6 groups. And when I say groups, I mean 6 cohorts with protected characteristics and multiple third sector organisations supporting those. And just to, again, recognizing that health inequalities, the more we digitally transform services, the more we're at risk of leaving these people behind. The one that I suppose I'm a little bit excited about at the moment is building on elective recovery. So this is actually funding digital health navigators. So I think Alexis was just talking about funding. I think it was Alexis near the end. I caught funding. I think she had 10 posts. We've got something similar, about 8 posts that we're about to get into secondary care services to support the elective recovery journey via a third sector organisation who are already providing hospital aftercare services. Because we recognise that if we're almost really sort of capitalising on the fact that elective recovery is where the funding was flowing and is a big priority. And if we're going to start to digitally transform elective recovery, then we're going to have to ensure that the patients don't get left behind with it. And then the older adults, we did a little piece of work with our Aging Well programme to try and target older adults. And I suppose the key thing is that we've sort of built a bit of a toolkit now. So it mentions at the bottom there, Digital Unite. We were very fortunate to be one of the NHS X pilot sites, and we're actually the most successful NHS X pilot site. We've used 54 licenses of our allocation from Digital Unite, and we've reached over 600 citizens with that. But I think the only reason that we've been so successful is because we've actually used the funding for the other projects to support the third sector organisations to deliver that. And I think moving to a model where we have funded roles, I think is really important. And I'm happy to talk about that a little bit later. Orca we use, and we're developing sort of stronger relationships with Orca to support our frontline staff to be able to embed app prescribing so that the digital offer, whilst it focuses on what people's needs are, and if that's help to get your shopping online, or if it's help communicating with your family, then that's what's most important to that person. But trying to sort of drip feed every opportunity we get, trying to drip feed an opportunity to engage with health as well. And we've been doing some evaluation work with another organisation, HealthWave. So I think that's, I'm sorry, I may have taken a bit longer than I was supposed to, but that's us in a nutshell, really.
Perfect, Linda. Thank you so much. No, not at all. With the time, that was all fascinating stuff. And thanks, Rob, for sharing those slides and going through. That's been like just 30 minutes there. I think I've learned so much, and really, really thank you to all three of you for kind of coming today and sharing your stories, your experiences. And I think we can all see that it probably mirrors a lot of what everyone else is thinking at the moment and seeing in terms of the challenges that they can see in front of them and they're starting to experience already in this area. So I've been scribbling all sorts down and questions, but we have got some set questions that we've put together based on the work that we've been doing over the last couple of months and the topics that have kind of really floated to the top as we've been doing the work with the pioneers. So I'm going to dive into those. But what I would ask is everyone else on the call, if you've got any questions, feel free to stick them in the chat or put your hand up if you want to kind of follow on from one of these questions or got anything else to do. So we'll go through that way. And like I say, at the end, we'll have a little bit more of an open discussion, hopefully before we finish today. Okay. So the first question is about funding, which is probably no surprise to anyone on this call that funding came up time and time again in the self-assessments that we did. And in most of the conversations we have, it's always, how do we sustainably fund this sort of work? So the number one barrier which has been identified is funding. Or we talk about it as investment. I think a couple of you have touched on that as we've discussed the 3 different projects in the areas that you work in. But we see it as investment in inclusion both nationally and locally. And you have mentioned it a little bit. And I think, Sarah, you also talked about something you're about to try with the kind of 10% thing. But the question really is, how have you either been able to or started to overcome the barrier of kind of long-term sustained investment in supporting digital transformation in an inclusive way and digital inclusion as well? So
is that to me?
Do you want to go first, Linda? It's to any one of you.
I can, yeah. Yeah, so I think we've got a key opportunity at the moment, haven't we, thinking about the future with the digital transformation investment plans. So we're starting to work up, what does gold standard digital inclusion look like? And, what do we need support from the centre for? I think there's become a much greater recognition over the last couple of years that we can't underfund this anymore. If we want digital transformation to work, we have to have resource for it. I think I would go back to what I said about digital inclusion is everyone's business. And there are pots of money all over the place, and there's money being spent in local government and other organisations that it's not always about the money. So if we can partner, then we get opportunities to support people to on board with health issues, even though it might be libraries or some sort of funding through the national or through the local government route that's actually supporting the activities. I think we're very fortunate in the Northwest. Our regional director of digital transformation is fully on board with digital inclusion, and she has before we sort of moved to ICB status, when we were talking about sort of bidding processes being the traditional way of accessing funds. She has given us full support that she will ensure that all bidding processes include a section, which they haven't traditionally, on how will you demonstrate that this programme will not impact on inequalities via digital exclusion, so that then in turn the organisation seeking the funds or the ICB, ICS seeking the funds actually has to factor that in. I think top slicing or bottom slicing, whichever way you look at it, is probably a good idea. But I think as well there's got to be maybe some recognition from the centre. We've talked, Alexis and myself have talked today about roles being funded, and I think this idea of a digital health navigator as a funded post should be part of the DES contract, perhaps in primary care, just like a social prescribing link worker. I think we have to accept that these are probably roles that the NHS is going to need in the future. And so there should be something central, I think, on that line. And I think we've got this big opportunity to raise, wave the flag of digital inclusion now with our transformation and investment plan workups that we're all doing. We all have to do.
Thanks, Linda. Sarah or Alexis, did you want to come in on that as well?
Yeah, I would agree with a lot of what Linda's just said. I suppose we were quite fortunate when we were first thinking about this and looking for transformation funding opportunities to support this. HSLI funding was around, and we got a significant amount of money to kickstart that over 3 years. So we were very lucky. We probably pitched it right at a good time, right at the beginning. But also similar to I think what Sarah and Linda have been saying, we're building that in. So where we've got pots of transformation funds available to us, whether that's in primary care, elective recovery, we are building an element of digital inclusion in there. So the roles that we talked about, the 10 roles that we're looking to employ across PCN areas, we're looking at utilising some of the digital first primary care funding to support some of that, would be an example. So I think it's just about being clear that it doesn't have to be specifically digital inclusion funding. If there is funding to support digital transformation, there is a need. So I would consider the digital inclusion bit similar to what training do you need for your workforce to get them, what engagement do you need? So it's an underpinning thing, and I think it's not been considered as such previously. So we've got to change the way that we are putting forward these plans and these bids in our systems or organisations to say, a key requirement to the success of this is that we build in some funding for something around digital inclusion, whatever is best to support that specific piece of work. But I agree with Linda, there's a really good opportunity now with the 3-year investment plans that we're having to create as a system and unified tech funding. Also in the operational planning guidance, there is specific mention of digital inclusion. I know that's particularly for workforce. And I think Sarah mentioned it earlier, we have focused very much on our population as far as digital inclusion, and we really need to look at how we better support our workforce. We have done some stuff around, we had some ESF funding to do some specific digital training and digital leadership training, particularly with our women's workforce, to try and bring more women into digital and upskill them. So that there is opportunities out there. I think it's just, don't have tunnel vision looking for specific digital inclusion training, see where you can build it into other stuff.
Perfect. Thanks, Alexis. And Sarah, was there anything else you wanted to add around funding?
No, beg, borrow, steal. We were, again, just lucky that we had digital aspirant funding, and I just happened to be in post and say, let's put some in for digital inclusion, but we wouldn't have had it if I hadn't, not like, look at me, but like if I hadn't have thought to kind of put it in there. So it was luck rather than kind of by design. But we are, as you can tell, we are on a very early stage of our journey. We're in first year of kind of looking at this stuff. But being the least digitally mature gives us more opportunity to build this stuff from scratch and have used some of that funding, which has been quite useful.
Perfect. Brilliant. Thanks, everyone. That some incredible. I've been, again, scribbling loads of notes and some like circling a lot of things. There's some really kind of tangible things there as well. It's not just kind of theoretical, kind of would be nice to have these things, but those really actionable things about getting roles funded, about thinking about writing this stuff in at the very beginning, and using examples like you did there, Alexis, of going, there's questions about training. Why aren't there questions about making sure that this work isn't negatively impacting people around exclusion? So yeah, some really, really rich stuff there. Thank you. My next question is around strategic influence. And again, this is something that's kind of been brought up quite a lot as we've been discussing things across the programme. And we've highlighted the importance of influencing the wider integrated care systems, and especially senior leaders as well to kind of really back this. You mentioned someone, Linda, obviously you've got some good backing there. But is there anything that you would, any advice you would give around how to do that influence, how to get those people that need to be aware of this, valuing this work at the very beginning, at the very top, at the very centre of this? Is there any advice about how you can do that and engaging them and influencing in that way? And that's open to any one of you if you want to jump in.
I'm happy to go first because we're really at the start of this, and then you can pick up. But being able, as I said at the start, being able to fly under the radar has been really useful because it's allowed us to, well, for me, to kind of find people that are also passionate about it in the organisations, use a bit of Thrive, and come up with a way that we think works best, and then take that upwards, so that as the kind of issue of digital inclusion ramped up and how often the boards were getting asked for it, rather than them going out, what's the solution, starting from scratch, as they started to get it on their agenda, we were underneath building something so that we converged and said, actually, don't panic, we've got a solution for you, and just give it to us to worry about. If you've got some money, give it to us to worry about. And that's kind of how we've managed to do it. And I'm not sure it would have been so easy, and apologies if this is where other people are, if it kind of hit the national agenda and then come down with some money, because that always seems a little bit more tricky. So as I said, spent a lot of time just building relationships with people either already working in this space, finding out what they were done, building on where there was already kind of work and energy, rather than trying to start something from scratch or create a health silo all on its own. So that, again, you're not then forcing against other things that are already existing, or trying to gazump other things that are already existing. So you're kind of, you have less resistance from the start. And even just this morning, while we were kind of doing our kind of check-in, our director of public health of the ICS is like, we've got to put something in about digital inclusion. Is then like, are you doing anything? And as Tim knows, we've invited them into meetings lots of times, but now it's on the agenda. Now I'll be able to say, well, yeah, I think we have got a proposed approach, and this is what we want to do, and this is how we're going to fund it. And so that gives him a sense of relief, because he's not got to find out now what to put in it, and it gives me a sense of well, autonomy, because he can't really question what I'm putting in the box because he hasn't thought about it yet. So I've done it that way. It's probably not the official way of doing things, but that's the way we've managed to do it.
Yeah, but that's what this is about. We want to know what's really happening, Sarah. So yeah, thank you. Linda or Alexis, either of you want to add on to that?
I can go next. I suppose I will admit it was a struggle. So because we started 5 years ago, before digital inclusion was a thing, I'm happy that it is now a buzz word and it's a sexy term that everybody's interested in. But 5 years ago, it was a struggle to get people's engagement, because the message was very clearly, why is this our problem? Why should we do anything about this? So it was quite a challenge, I think, initially to get that buy-in. But similar to Sarah, I think we went off, because we secured funding, and that allowed us to do our research, our insights, and put in place pilot schemes to really prove the worth of supporting people and being more inclusive around digital. That obviously helped us to get the buy-in further up the chain, building that into our digital strategies as well. I think it's awful to say, what's really helped has been COVID, and really bringing digital inclusion to the top of everyone's agenda. And similar to Sarah, we're now getting, everybody's coming to say, what about digital inclusion? Have we considered this? I need to put something around digital inclusion in this strategy that I'm developing. And I think the health inequalities agenda is really helping drive that as well. So it's not just seen as a digital thing that's in a digital strategy and a digital problem. It is a system problem, because actually by not supporting people and being inclusive around digital is impacting on health inequalities as well. I think I know I'm going a bit off topic, but I think it's really important to talk about this when talking about the health inequalities agenda. We recognise, and I think Linda, you mentioned it, about digital health literacy as well. And I think what we found in our second round of insights is, because we were very focused on digital inclusion, that we have to also focus on digital health literacy as well, because those groups of people that we would see that face health inequalities because they're excluded, we did some specific insights work with them, and they were basically saying, it's not the digital bit that excludes us, it's not access to service that excludes us, it's the way that you communicate with us that excludes us. You don't understand, it's not person-centered, you don't understand us as a person. So this was a specific thing around diabetes, and we worked with our African and migrant community in our city, and they were saying, I've been diagnosed with diabetes, you give me some information telling me to do X, Y, and Z, or to change my diet in a certain way, but you don't understand me as a person and my culture. So an example being around white rice, that, people tell us, you can't eat white rice anymore. Well, actually, I eat white rice for breakfast, for lunch, and for dinner. Therefore, I don't feel like you understand me, so I'm going to exclude myself. I'm not going to choose to access those services because I don't feel like you understand me as an individual. Sorry, that's a bit off topic around that, but I think it's a really important thing to think about. So if you're thinking about digital inclusion or inclusivity, but also think about digital health inclusion as well, because I think that's often forgotten, but that's one of the things that's been highlighted through this process for us.
Thanks, Alexia.
Maybe a couple of minor additions really from our end. Digital inclusion is now very firmly on our governance meeting agendas. So I think it's really important, and we therefore have an obligation to report, and it's seen by everyone, and it's mentioned in our integrated care partnership steering group meetings and things as well. I think Alexis raised a really valid point that it's not just digitals to own, it's about the non-digital governance and ownership as well. Health inequalities are really recognising, and population health are really recognising that it's as much their issue as our issue. And I have to say again, with great support from the Northwest, what's currently the Health Inequalities Delivery Oversight Cell, I think that's probably going to transform into a board now. We're sort of post-pandemic. But it's regularly on their agenda as well, and we go and we, as ICS leads, we go and we present on what we're doing to them as well. And I think the other thing Sarah mentioned about sort of having champions, you know, getting senior leaders who are champions. I mentioned our regional director of digital transformation. She's a champion. But we've also come across some of our non-exec directors in some of our organizations who are, you know, really loudly speaking to some of our CIOs and CCIOs in the organizations that are part of the partnership. And I think it's just about finding those people who will rally for it and recognise that it needs to be on agendas more regularly. So yeah, that's probably all I would add.
I add one more thing. Sorry, Linda, you've sparked something in me, and something that's been really important to us is about our patient power, in effect. So we've done lots of user-based design, and we've worked really hard with our population to understand their needs and wants, and actually to a point where they're quite vocal about where things are not happening or not being taken seriously enough. And the power actually from patients is much more impactful than some people just saying, banging on the door and saying, why aren't you thinking about this more in a more strategic way? Why isn't this top of the agenda? Actually, if you've got patients knocking on your door holding you to account, it's quite a powerful thing.
I just wanted to add one thing, going back to Linda's point, is that actually, and Tim, I know we've discussed this, is digital exclusion a thing, in that it's the same with digital transformation. Digital shouldn't be leading anything, it should be enabling something. So for me, digital transformation isn't a thing. We're trying to transform or improve care, and digitally enables it. It's the same. We should be trying to make our services more accessible, more inclusive, more co-produced with patients, of which digital is just one element of it. Because it's like some of the national programs coming down at the moment, we're like, well, how are you translating these? How are they accessible to people that can't access digital, or like need BSL or whatever it is? And it's that broader accessibility agenda. And I think digital always ends up driving things because that's where it pops up and that's where it's got the money. But we need to shift it. It's part of that wider inequalities, which for me is core NHS business and how we do it more broadly. And there will just be some elements that have to be digitally considered within that broader context.
Yeah, absolutely. Thank you all. So my final kind of the three questions that I'm going to ask is around partnership. So obviously integrated care systems by their very nature are about partnership working, which offers huge opportunity, I think, and everyone's touched on partnership at some point through this morning. So just a final question really about what your experience has been. How have you gone about building those partnerships? Who with, and what have been the benefits of those partnerships? And if it's all right, I'll come to you first, Sarah, obviously, because I know you need to nip off at 11. So if you want to go first on that one.
Right, I'll always say things to get in trouble. I think one of the things that I found is that people say they want to work in partnership, but they don't. When people are highly stressed, they just are worrying about the thing that they want to worry about. So for example, the My Planned Care stuff that's coming down, or the personalised outpatient, they're in their own little silo about how they kind of solve that problem, and you're like, but we could do it in partnership, and like, that sounds really good, and then you go away and they've gone back to just trying to solve the problem in their silo. So I think again, it's been getting under that kind of senior layer to the people that can make it happen and building that network, so that we've got solutions in place and we've done a bit of the work, so that when that stuff pops up, which is why I had the slides ready, I could go to Pop and go, actually stop thinking about how you're going to fund it individually for your one organisation in the system, move it over, we've got a more central way of doing it. Because I find the exec like wanting to work across social care, wanting to work across the voluntary sector, in our digitally immature and probably kind of immature in general, they're not quite there. They don't actually fundamentally quite believe in doing stuff in partnership. They're still too much in reactive mode and still kind of too busy with stuff. So yeah, we're trying to create, I guess, trying to create our own grassroots movement that we can shake up, is how we've been trying to do it.
Yeah, that makes complete sense. And thank you for being honest, and thank you for saying that, Sarah, as well. Linda or Alexis, did you want to add anything?
Yeah, I can go next. So we set up a community of practice quite early on in the pandemic, and that's been really, really successful. I would say there's probably it's now, I think, monthly. It might have been fortnightly in the early days. There's probably 30 people who turn up from our voluntary community, faith, social enterprise organisations, local government, health, And there's a real passion to work together. But it is, like Sarah said, it's the people closer to the ground who are actually going to do something. And it's just been an opportunity for us to, it's become more about sharing learning lately. Now that sort of activities slowed down a little bit, there was such a big drive early in the pandemic because of, activity around getting kids laptops for schoolwork, as well as vulnerable people at home and things. But I think that's been really, really successful for us. We also partner and work closely with, and from a shared learning, I suppose, perspective, our other ICSs in the region. So we've been working quite closely, particularly with Cheshire and Merseyside. We do a lot of shared learning between the two sites. But yeah, our community of practice has just been such a success. We started to wonder, do we still need it? But there's still people turning up every month wanting to tell what they're doing and see if there's an opportunity to collaborate. So yeah, that's been really successful for us.
Alexis, anything else you want to add?
Yeah, just to agree, really. I think what we've tried to do is map who's doing what across the area, because what we don't want to be is in a competitive nature, because I think there is still a significant amount of maturing that we need to do as systems. Like Sarah said, very much still organisationally focused when we're under significant pressure, rather than system thinking. And hopefully, with the ICBs becoming a statutory body, that might help shift things. I think we're quite lucky in that Connected Nottinghamshire is a digital programme of work across the ICS. So we've got system resources to help support and coordinate and deliver some of this stuff. So what we've kind of tried to do is similar to Linda, is build those collaborative working spaces. So actually we're not duplicating effort, and we can work out as a system where we can have the most impact. So, if a local authority is doing something in this space, whether that's around devices or connectivity, then actually we wouldn't necessarily want to tackle the same thing. We would look at kind of support and training. I think the biggest thing for me, and I think I said when we did our introduction, is we were naive at the beginning. And I think our strongest partnerships and collaboration has been with the community voluntary sector, because they're in the heart of their communities. They are able to engage better with people that we aren't necessarily able to engage with, because they're a trusted member of the community. And what we found is what's around sustainability is, if you're working with community voluntary sector, it's almost like a waterfall effect. They're working with their communities. Members of those communities are then going back into their communities or their household and sharing their learning and understanding. So it's trickling out that way. And actually it's much more powerful, much more sustainable that way.
Yeah. Brilliant. Thank you both. So that brings us to the end of the kind of formal part of the panel and the questions.